Have you ever trusted someone with your health decisions only to realize too late it was a mistake? I have, and I'm here to tell you what I learned the hard way, so maybe you don't have to. Hi, I'm Linda, and today I'm sharing a story that's not easy to talk about, but could save you years of frustration, pain, and even danger. Stick with me, because whether you're 60, 70, or just thinking ahead, knowing who not to trust with your health is just as important as knowing who to trust. It all started a few years ago when I first felt a strange pain in my side. Like a lot of people, I turned to doctor. Google first. Bad idea. Within minutes, I had convinced myself I had everything from kidney stones to cancer. According to research from the Pew Research Center, over 70% of Americans search online for health information, but less than half check the source. I didn't. I just panicked. That was my first mistake, trusting the internet over real professionals. But it didn't stop there. I told a few friends what was going on, and everyone had an opinion. My cousin used this herbal tea and it worked wonders. You need to detox. Try this supplement, it's all natural. They meant well, but none of them were doctors. Still, I listened. I tried some strange remedies. I spent hundreds of dollars on supplements that promised the world. Nothing helped. In fact, some made me feel worse. It was a wake-up call. I learned the hard way that you can't trust random advice when it comes to your health. It doesn't matter how nice someone is, how convincing they sound, or how many likes their Facebook post got. Health isn't one size fits all. What works for one person could harm another. Researchers like Dr. Atul Gawande, a renowned American surgeon and writer, emphasize in his book, Being Mortal, that the quality of your medical advice matters more than anything when you're facing real health decisions. You need experts, qualified, compassionate, science-based professionals, not noise. Eventually, I went to a real doctor. Not just any doctor. A board-certified internist who took the time to actually listen. She ordered the right tests. She ruled out the scary stuff. She found the real cause. Something manageable. Something treatable. Not life-threatening, thank God. But if I had kept trusting random advice, things could have gotten much worse. From that experience, I learned a few key rules about who not to trust with your health. First, don't trust people who push one miracle cure for everything. Real health is complex. There's no magic pill that works for every person and every condition. The Mayo Clinic warns that if it sounds too good to be true, it probably is. Second, don't trust people who aren't willing to say, I don't know. Real experts know their limits. If someone acts like they have all the answers without even asking detailed questions about you, be cautious. Third, be wary of anyone who stands to profit off your fear. Whether it's selling you expensive supplements, unproven treatments, or fancy devices, if they make money only if you stay scared, that's a red flag. I wish I had understood that earlier. My panic led me into some traps. There's an old saying that when you're a hammer, everything looks like a nail. Some practitioners only see one problem and one solution, because that's all they know. That's why it's critical to seek out second opinions, third opinions if needed. According to research published by the Mayo Clinic, 88% of patients who sought a second opinion received a new or refined diagnosis. That number is too high to ignore. It means a huge number of people are misdiagnosed or partially diagnosed the first time around. Don't be afraid to ask questions. Don't be afraid to say, I need to think about it. Your health is your responsibility, Not your doctors, not your friends, not a stranger's online. Yours. And you have every right to take the time you need to make decisions that feel right for you. After my scare, I started paying closer attention to how often people hand out health advice without any real understanding. It's everywhere. Family members, friends, even well-meaning strangers online. I remember one afternoon I bumped into a neighbor at the grocery store. I casually mentioned I was dealing with some fatigue. Before I could even finish my sentence, she launched into a 20-minute sales pitch for an essential oil blend she was selling. She swore it could cure everything from arthritis to heart disease. She meant well, I'm sure. But later I learned the FDA had actually issued warnings against some of the claims made by companies selling these oils. That experience taught me, be especially cautious when someone profits from your problem. Another hard lesson I learned was about trusting doctors too quickly without checking their background. Not all doctors are equal. Some are wonderful, caring, skilled, and honest. Others are rushed, burnt out, or tied to systems that prioritize profits over patients. A famous report from Johns Hopkins University found that medical errors are the third leading cause of death in the United States, right after heart disease and cancer. That shook me to my core. It means we must be active participants in our care, not passive recipients. I started researching how to choose good healthcare providers. The best advice came from Dr. Jerome Groopman's book, How Doctors Think. He explained that even the best doctors can fall into thinking traps, anchoring too fast on one diagnosis, dismissing symptoms that don't fit their expectations, letting bias cloud their judgment. So I changed how I approached my own doctor visits. Instead of walking in nervous and silent, I started bringing written questions. I took notes. I asked, "What else could this be?" I asked, "If this were your mother, what would you suggest?" These simple questions forced better conversations. It made a difference. I realized I wasn't being a difficult patient. I was being a smart one. There's a myth that good patients are quiet and obedient. But real health advocates like Dr. Danielle Offrey from Bellevue Hospital say the opposite. Engaged, questioning patients, get better care. One of the most painful lessons came when my best friend, Carol, trusted a shady clinic advertising stem cell miracles for arthritis. She spent thousands out of pocket because it wasn't covered by insurance. The treatments didn't work. Worse, they delayed real medical care that could have helped her. Watching her heartbreak made me promise myself, I will never again trust anyone who promises quick fixes without solid proof. And that's something I want you to remember too. If a treatment is legitimate, it will stand up to hard questions. It will have research behind it, peer-reviewed studies and transparent risks and benefits. If it's all promises and no proof, walk away. You deserve better. You deserve real care. There's also one more group you have to be careful around: yourself. That's right. Sometimes the person we most need to be wary of when making health decisions is ourselves. Our fears, our impatience, our wishful thinking. I know because I fell into that trap too. I wanted so badly for my pain to have a simple answer, a quick fix, that I grabbed onto the first thing that seemed hopeful. I ignored red flags. I skipped hard conversations, learning to slow down, to breathe, to gather real information before acting. That was one of the hardest but most powerful lessons of all. Health decisions are emotional. They can trigger fear, desperation, confusion, and in those moments it's tempting to latch on to whoever offers easy answers. But healing isn't found in shortcuts. It's found in thoughtful, careful, courageous choices. After learning all these hard lessons, I realized something deeper. Health isn't just about doctors or medicines or test results. Health is about agency. It's about reclaiming your voice and your choices in a world that often tries to take them away. Especially after 60, when too many systems start treating you like you're invisible, like your questions don't matter, like your worries are just normal aging. I want you to hear me loud and clear. Your voice matters. Your instincts matter. Your experiences matter. Too many times I sat in waiting rooms feeling rushed, unheard, small. Too many times I left appointments confused and afraid, but too embarrassed to ask more questions. Not anymore. Now I advocate for myself. I bring a trusted family member to appointments when I need support. I ask for clear explanations. I read the fine print. I look at second and third opinions without shame. And you should too. Because your health journey is yours, not anyone else's to control, dismiss, or rush through. I think about my friend Mary. She's 72 and one of the strongest women I know. A few years back, she was told by a rushed doctor that her chronic cough was just aging, and she should accept it. But Mary didn't. She trusted her gut. She found another doctor, a pulmonologist, who took her symptoms seriously. Turned out she had early-stage lung disease, treatable because it was caught early. Today, Mary is still walking her dog every morning, laughing with her grandkids, living fully. Because she trusted herself enough to keep asking questions. That story stays with me. It reminds me that no matter how old we are, we have the right to be taken seriously, to be treated with dignity, to demand answers, not brush-offs. The American Medical Association even says patients should expect honest communication, respect, and full transparency as basic rights. You don't earn that by being nice. You demand it by being informed, prepared, and persistent. One more thing I learned the hard way is how important it is to build your health team, people you truly trust. It's not just one doctor. It's a primary care physician you trust, a pharmacist who knows you by name, specialists who welcome your questions instead of rushing you, maybe even a counselor or therapist, because mental health is just as important as physical health. Your team should empower you, not intimidate you. They should respect that you are the expert of your own body. And if they don't, you have every right to find someone else. It's not disloyal. It's self-respect. Another lesson? Don't put blind faith in anyone just because they have a title. Credentials matter, but character matters just as much. I once saw a specialist who was very respected in his field. All the diplomas lined his walls. But in the exam room, he barely looked me in the eye. He rushed through my history. He seemed more interested in his computer screen than in me. I left feeling like a number, not a person. Later, I switched to another doctor with the same training but a completely different attitude. He listened. He cared. He explained things slowly. He treated me like a human being. And that made all the difference. Studies from Harvard Medical School show that patients who feel respected and involved in their care experience better outcomes. Respect isn't optional. It's essential. I also want to touch on something that not enough people talk about. Trust your body's wisdom. After 60, we know our bodies better than anyone else. We notice the subtle changes, the whispers before the screams. Don't let anyone gaslight you into thinking it's all in your head if you know something isn't right. Early detection often depends on us speaking up when something feels off. And don't feel bad if you can't always explain it perfectly. You don't have to be a medical expert to know your own body. Finally, here's something I wish someone had told me earlier. It's okay to fire a doctor, a provider, or an advisor who doesn't respect you. You are not stuck. You are not obligated. Your health, your time, your peace are far too precious. Every appointment, every interaction, every choice is another chance to protect your life. And that is sacred. You deserve a care team that values you. You deserve advice rooted in truth, not fear or profit. You deserve to feel safe and empowered, not rushed or dismissed. And maybe most importantly, you deserve to trust yourself. At every age, but especially now. You have earned your wisdom. You have earned your voice. Trust it. Honor it. Let it guide you. Because nobody, and I mean nobody, will ever care about your health decisions as much as you do. And that's not selfish. That's survival. That's love. That's strength. At the 60+ chapter, we believe in creating a life you love, mainly after 60+ age where not much people and supports are with you. Every story we share is meant to bring hope, knowledge, and tools that help you live better, not just longer. We are here for you and will keep bringing you real stories, practical tips, and trusted advice every day. Don't keep this to yourself. Share this video with someone who needs to listen, or if it simply gave you hope, please take a moment right now to click subscribe. It costs you nothing, but it means everything to us. It helps us reach more people like you, and it keeps the 60+ chapter channel going strong. Let's grow this beautiful community together.